So now we're getting to the important parts. What is the recipe to be able to fall asleep? What's the secret recipe? Any clues? Relaxation. What else?
No caffeine after such and so.
No caffeine. Okay. Darkness. So we're hearing about environment, darkness, avoiding the caffeine, coolness, so environmental issues, right? Making your environment good for sleep. Good?
Not eating a large snack before you go to bed.
Right. So that's sort of part of the biological, you don't want to get your digestive system churning and going, because that might cause up, acid reflux. It might cause other problems interfering with sleep. Yeah? Anything else? Lying down. Winding down. Relaxation. Very good. Routine and schedule. I'm loving it. You guys are great. You should be giving this talk. Well, I think that the first part of the recipe you missed, and that is you need to be sleepy. Remember, we talked about this. You can't fall asleep unless you're sleepy, right? Well, that's not exactly right, because if I put you in a dark room at 10 o'clock in the morning and I told you to take a nap, you could probably do it. Okay, it might take you half an hour to get there, but you could probably do it for a little while. It would not be a great night. It wouldn't be a great rest. We could probably do it. But if I put you in a dark room at 10 o'clock at night, the typical person probably not off a lot faster. Fair enough? Okay. So absence of distractions. We talked about this. Quiet, dark, temperature's right, the mattress is comfortable. Absence of biological factors that might interfere with sleep. Make sure that pain. We'll come back around to the pain because that's important in this room, right? Hunger, medication side effects, etc. So you can neither be too hungry nor too full. You kind of have to be a happy medium, right? And also make sure that you're not particularly anxious. Your adrenaline levels from the anxiety are not particularly high because many people, if they can't sleep, they get anxious about it. We'll talk about that a little bit. Okay. Or you can get used to the distraction. So if you're on a diet, and if you've been on a diet for about a month, you go to bed hungry probably, but you're kind of used to that by now. So it's not going to be bothering you. You'll probably be able to fall asleep despite the fact that your stomach's churning a little bit. You can get used to stuff. Like living next to the railroad tracks, right? People figure out how to sleep even though the trains are going by every 20 minutes. It's amazing what people can get used to. Crying babies, railroad tracks, whatever. Well, so you tell me, Doc, the problem isn't falling asleep. The problem is that I keep waking up in the middle of the night. So what's the secret recipe to be able to stay asleep? Ambien. Okay. Hypnotic medication was suggested. Earplugs. I'm liking that. Earplugs. We're going to circle back around to the earplugs in a bit. Anything else? No daytime napping. I'm liking it. Okay. What else? No late night caffeine. Very good. So a lot of the factors are the same, right? Sleep drive, again, is at the top of the list. Avoiding the daytime napping, avoiding the caffeine. You want to be sure that your sleep drive is strong enough. Yeah?
Is it okay if you're up real late, you can't get to sleep, to take sleep caffeine or
Yeah, we're going to circle back around to that. That's a really good question. The question was, is it okay to take some kind of natural sleep remedy if you can't get to sleep? And the cliff notes is yeah. Yeah. The answer is yeah. Only that if you take it in tea form, you may need to get up an hour later to pee, which kind of interferes with the problem. So you can take this stuff in a capsule form with a little sip of water, and sometimes it works just as well, and then you don't have to pee. So again, absence of distractions, environmental or biological. And now there are other biological distractions that we're going to talk about. There's snoring, your bed partner's, i.e., okay. There's sleep apnea, your own. Nocturnal limb movements, pain, of course, you change body positions and ow, oh, right? And of course, here's the anxiety and the adrenaline factors like, oh, darn it, I'm up again, and I know I have to be at my best tomorrow morning, and I know if I don't fall asleep, I'm going to be tired, and here we go again, right? How many have had that experience? Yeah, virtually everybody in this room, right? We're going to circle back around to that briefly, too. All right. Fortunately, the biological clock can be trained. So this is the part where I like to do my comparison. The brain is like a dog. Brains are like dogs. Brains are like dogs in that they're faithful, despite the fact that we think that they're really smart. They're actually kind of dumb, especially the reptile brain part back here that controls wakefulness and sleep. And they can be trained, but you have to provide discipline and consistency, just like training a dog. You have to take them to obedience school, okay? And we'll talk about how you can take your brain to obedience school as part of our talk today, okay?
You have to take it out for a walk?
Take it, yes, exactly. We'll talk about that. So the cliff notes, how to do that, include limiting your time awake in bed, limiting the total time you spend in bed, because there's a temptation for FM people to spend a lot of time in bed, isn't there, right? Come on, let's fess up to the facts, right? And also maintaining a consistent wake time so that you have an anchor point of the day that's consistent. So you're telling your biological clock, hey, this is where I start. This is where it always starts at the same time. It doesn't start at different times every day. It always starts at the same time. That way my biological clock will know that it's time to be sleepy at a certain time too, okay? Judicious use of melatonin and bright light therapy can also be quite helpful. And we can circle back around to that, although that's kind of the more advanced version. And we'll see how much time we have in this talk. All right, I want to do a case study. So forgive me if your name is Joanne. The name just shot into my mind as the first name that I could think of. We're going to talk about Joanne. This is sort of a composite of people who come to my clinic. Joanne's 48. She used to be an administrator, kind of high-powered, but now she's on disability due to her fibromyalgia and chronic fatigue. And she's coming to me because she's having trouble both getting to sleep and staying asleep. And she spends most of her time at home or going back and forth to doctor's offices, therapy, and so forth. Okay, that's kind of the scope of her life now, so a lot narrower than it used to be. Sound familiar? Yeah, because her daily activities are limited by pain and fatigue, right? Well, her fatigue can be bone aching at times, really bad. And yet she's unable to nap during the daytime for the most part because she's kind of wound up on account of the pain levels too, right? Except maybe once a week or so when she crashes. And when she crashes, she sleeps all day, right? And then she finally kind of comes out of it the next day, and then the cycle starts again. She tries to go to bed around 9 o'clock. She lies in bed for several hours, but she's unable to get comfortable. Sound familiar? Right? She's frustrated because she knows she's going to be tired the next day if she doesn't sleep tonight. So she says, my mind starts racing. And then she takes a sleeping pill. And even with a sleeping pill, she might take an hour or maybe even longer to finally settle down and get to sleep. And she kind of feels like she's dependent on the sleeping pill because without it, she's not going to sleep at all. Sound familiar? Yeah, it's a common problem, isn't it? All right. And about 3 nights or so per week, she gets up after a couple of hours. She goes to the living room, eventually dozes off on the couch watching TV. And then she's exhausted the next day, right? And she's tried everything. She brings you this list of 12 things she's tried. Over-the-counter medications, melatonin, antidepressant medications, the newer medications, Ambien, Lunesta, Sonata, Roserum. She's tried them all. They all worked for 3 days. And then they stopped working after that. Maybe a week if she was lucky, right? Or the doctor took her up to doses that were higher than the recommended amount just to get her to sleep, right? And that proved not to be a very good idea either because it left her feeling groggy the next day. So here she comes to your clinic and she's kind of got that look in her eyes like, yeah, one more doctor, like you're going to solve my problem. Right? So what's wrong with Joanne? Who can tell me what's wrong with Joanne?
She's got a bad mattress.
So we heard sleep apnea. She's got a bad? She's got a bad mattress. What else? Partner snores. What else? We heard anxiety from two voices. Voted for anxiety. What else?
She doesn't know how to go to sleep.
She has a dog.
Thank you. She's got a dog. Right. Very good. Who said doesn't know how to go to sleep? I love it. That's great. Insomnia as a self-fulfilling prophecy. Okay, that's what she's got.